Hi there and welcome back to my channel. Last time I talked about what happened before I found out I had cancer, and today I'm going to be talking about what happened afterwards and the testing I had done. After my regular OBGYN told me that I had cancer, I got told that I would have to go to a gynecological oncologist. The oncologist that I was supposed to go to see was on vacation, so she wouldn't be back until the following week. So I ended up talking to her associate instead. It was sort of funny. He called, and I had a room full of people. My parents were there, my husband was there, and the doctor was like, "Who am I talking to?" And I was just like, "Okay, this is who's in the room. You can say whatever you want. It's completely fine. Feel free." He was like, "Okay." And I don't know if he's ever experienced that before, but my family, that's the way we roll. We go in herds. But he told us that from what he saw and heard from everything, he thinks that I had 1B1. I'm not sure how he came up with that from just the information he had at that time. I didn't have any other tests done. I just had the cold knife done. But that's what he said. And he said if for 1B1, I could have surgery. So at that point, I started to do research on having a hysterectomy and what you had to do for it, how to prepare for it, what you needed for it afterwards, and things like that. So the next step that he wanted is for me to have a CT scan. And for the CT scan, I had to drink one bottle every hour for 2 hours and then go in to get the scan done. I almost didn't make it to the scan. My body did not like that stuff that I had to drink at all. And I almost didn't make it, but I made it. And I'm so glad because I did not want to have to go through that again. But they did the CT scan, and the following week I heard from the oncologist, and she wanted me to get an MRI done. This was my first MRI ever. I don't know if you've ever had one before, and I wouldn't classify myself as being claustrophobic, but even in those really tight situations, I'm sometimes not that comfortable. If you've never had an MRI before, you have to go in and you take off all of your clothes and put on the gowns and these cute little romper-like shorts. You go in and they ask you questions and go through everything, and then you go in and you lay down on the table. They ask you if you want a blanket, and I run really cold, so I always ask for a blanket. And I love when they give them to you and they're nice and warm. Doesn't stay warm for long, but when that initial blanket is just so nice. So they put you down, they put this cage on top of you so you can stay put, and your arms have to stay free. So try to get comfortable, just sort of do this, and then you go in. And one of my friends had an MRI done, and they gave me this tip. Before you get into the tube, close your eyes and don't open them until the whole thing is done. So they put you in, and of course I close my eyes. And I don't know, you don't have a watch, you can't have anything that you can tell time with, but it probably took about a half an hour, and then they tell you you're coming out. So you come out of the tube, and they give you, they're going to take your blood, and they put the tourniquet on, and they put a needle in, and they give you the contrast through your IV. And then they clean it up, and then they put you back in, and it probably takes another 10-15 minutes to run with a contrast so they can see before contrast and after contrast. So once that's done, you get changed and you can go. I think it was another few days or something like that, and I talked to my doctor, and then she wanted me to get a PET scan. And the PET scan was to see if you have cancer anywhere else in your body. If you have anything like lows, because what they do is for the PET scan, at least that I have, they give you radioactive glucose. And you sit in a room for an hour, and it's dark, you're not supposed to move. Because if you're moving your arm, your arm might show up in the scan, and you don't want that. So you have to stay as still as possible for about an hour. Then they come in, say, go to the bathroom, then you get the scan. And the scan's similar to the MRI, but it's not as uncomfortable. And that takes about 45 minutes, and then you go home. During my PET scan, I did have a little spot in my liver show up. So When I went to go get my port done, I was awake. And I don't know if you know what a port is. A port is a site that they use to give your chemotherapy. It's this little thing that they put underneath your skin. I could show you my scar. This is nothing else. It's just my scar from my port. And they put a line here, and they have a little tiny line up here that you really can't see the scar for. And they put a tube that goes up and goes into your vein, so that the chemotherapy agent goes through here, goes up the tube, and right into your vein. And that way they only have this little section. You're not allowed to have anybody else except for the oncologist nurses touch it. But that's my scar from mine because I already had mine out. But when I had my port put in, I also had to have a biopsy done of my liver. They put me out for that. I was awake for the port. They put me out for the biopsy. And in order to get to my liver, they had to go through my lung. So after I woke up and I was in the recovery section, they waited an hour, and during that time, I felt tightness in my chest, and something just didn't seem right. So they did an x-ray to see how my lung was doing. Well, unfortunately, my lung partially collapsed. And they told me at that point that they were going to have to wait another 2 hours to see if it gets better, if it stays the same, or if it gets worse. If it got worse, I was going to have to be hospitalized, and they said I probably would be in the hospital for a few days. Thank goodness after 2 hours it had stabilized and it wasn't severe enough where they could allow me to go home. So I went home, and after a few days the pain was gone and I was fine. After all of my scans were done, I had another appointment with my gynecological oncologist. She said looking at all the data that they had, they couldn't say that I was at 1B1 anymore, and they were upping me to 1B2. Therefore, she wasn't recommending surgery anymore. So she said the dreaded words. And she said that she was recommending that I get radiation and chemotherapy. Radiation is the main treatment to kill off cervical cancer. They recommend chemotherapy because the chemotherapy helps the radiation work better. So any little thing I can get to prove my outcome, I decided to do. So we went ahead and decided to do that. I was going to be getting cisplatin, and cisplatin is known to cause problems, and one of those problems is hearing loss and or deafness, which is very rare, but it can happen. So before I went and started with the treatments, I had to have a baseline of where my hearing was. Blood work, had 2 to 3 doctor's appointments every week between the gynecological oncologist, my chemotherapy oncologist, my radiation oncologist. I had the ear doctor. I had blood work that I needed to do. And you have to have blood work done the day before you have chemotherapy. So you had to do that every single time. So it was a lot of doctor's appointments and a lot of jumping around and keeping track of everything. What appointment is this day? What am I doing that day? Okay, I have a rest for a few days so I don't take a break. And that will be it for this video. Next week, I will be talking about the actual treatments, what I went through. Thank you for joining me again, and I hope that you have a good week, and I look forward to seeing you next week. Okay, bye.